Hello visitors, I am Prachi, a digital healthcare analyst and expert for the very special session and discussion for digital healthcare system in our Indian healthcare ecosystem. We are welcoming our special guest, a young business entrepreneur and a software engineer, Mr. Imran Khan. His hard work and dedication towards his aim for digital healthcare system proved a huge example for forthcoming startup initiators. His commendable work praised at many national and business stages. I welcome you at this forum for giving your precious time to us.
Thank you so much for your appreciation and inviting me at this forum to discuss a very important subject, that is digital health infrastructure in the country.
Let's start with the very first question of this forum, Mr. Khan. What is SoftCure and what is the role of your application in healthcare system?
SoftCure is a hospital management information software that is specially developed for the health facilities like hospital, clinics, laboratories and nursing homes. This software operates all important key functions at outdoor and indoor department for patient treatment cycle. It covers patient clinical electronic medical record along with their payment and billing. It is a multi-user ERP software that you can access as per your roles and rights. In hospital, there are multiple departments like OPD, IPD, laboratories, TPA, reception, nursing stations, assessment counters, and MRD. With the help of this single software, you can manage all the departments on a centralized database system. So SoftCure is a complete suite of module-wise software that require at multiple departments within the hospital.
Mr. Khan, tell me something more about complete suite.
See, basically in hospital, there are multiple departments like your OP consultation, your pathology, your sonography, your inventory. So usually hospital needs to buy multiple products from their multiple vendors. So here SoftCure is offering a complete suite that cover all kinds of department.
A very big congratulations for your ABDM certificate for ABHA compliant software. Tell me something about your journey during this process.
Thank you so much for your appreciation. And yes, obviously ABDM certification is very important for improving the reliability and scalability of our product in the market. ABDM basically is a digital mission running by National Health Authority Government of India to support the integrated digital health infrastructure of the country. But giving all the credit to me only is not right. It's a teamwork where my team member work with their true dedication toward the company's goals and aims. The hard work done by the team of SoftCure is the result of this achievement. For certification, ABDM has invited hospital software vendor to be participate in this certification process so that we can make our product ABDM compliant. For that, we have applied 6 months back. And after process that given by NHA, we have successfully gone through the web application and security testing by certain panel organization approved by Ministry of Electronic and Communication. And then we have gone through the functional testing of API data exchange process. At the end, we have achieved that we have planned with a dedicated technical implementation model.
What is ABHA and ABDM and its implementation at hospital and clinics?
As I said, ABDM is a flagship scheme of National Health Authority Government of India. It stands for Ayushman Bharat Digital Mission, aimed to design the digital infrastructure of the country for healthcare system. Its objective is to eliminate the existing gap among medical practitioners while giving treatment to the patients. And about ABHA, I just want to explain directly to my viewers that ABHA is Ayushman Bharat Health Account. So if a patient is visiting a hospital for any kind of a treatment, so now a patient should have their ABHA account. So for that, they need to create their ABHA card. Now hospitals are ready to create their ABHA accounts. With the help of this ABHA account, you can have access of your ABHA mobile app. This ABHA account and ABHA mobile app is absolutely free of cost. You can use it. The benefit of this ABHA account is when you visited a hospital and go for a kind of computerized prescription and some kind of blood investigation reports, and if that hospital or health facility generates your data at their own ABDM enabled compliant system, at that time ABD system sends you the notifications over your mobile app that your data is now prepared and you can have access of your data. So with the help of the ABHA mobile app, a patient can directly pull the records what has been created by the hospital or practitioner over their mobile app by a single click. So this is the beauty of this ABDM system, that just before exiting to the hospital premises, you can directly have access of your all health related data over your ABHA mobile app.
Tell me, is this ABHA account and mobile application free or paid?
This basically scheme is running under the aegis of National Health Authority, and the creation of ABHA and ABDM is completely and absolutely free. It is for the welfare of patient for accessing their health records digitally.
What are the ABHA milestone and what is the functionality covered at each milestone?
See, milestones are something through which you can measure the functionality of an ABHA compliant software. So there are 3 milestones, that is M1, M2, and M3 for ABHA functionality. M1 stands for mainly ABHA card generation, where we need to generate the ABHA account of a patient. If ABHA account is already created for any patient, so we can go for the verification process. The very important feature of this milestone, that's scan and share. With the help of this facility, the patient can generate the OPD token number of their OPD without standing in a long queue and can directly scan the hospital QR code. M2 refers to the functionality of software, where a software can generate OPD prescription, wellness record, vaccination record, investigation record, discharge summary of a patient treatment, and having the ability to share these records directly to the mobile app of a patient on receiving the patient consent as per the data management policy. M3 refers to the functionality of a software, where software having the ability to ask the consent from the patients, so that software can have access of the patient previous health records that has been generated by some other ABDM compliant software at other hospital facility. This is the primary beauty of ABDM ecosystem, where a patient no need to carry their bundle of paper of previous clinical record while visiting the hospital. If a hospital is using ABDM compliant software, that their practitioner can directly view the patient all record over their computer screen.
Again, a very commendable work that you have gone through, sir, on all 3 milestones.
As I said that it is not only the work from my side, it's a teamwork. And yes, we have got certification for all the milestones.
Sir, so many companies are apply for the certification and they get it. So tell me something, what is special with your certification and applications?
See, there are multiple software vendors from the company who are in process for ABDM implementation within their software. Till date, around 1900 plus software vendors who are in queue for this ABDM implementation and in process for their API implementation. And till date, there are approximately 78 private companies who have got this certification. And we are from one of those private companies who are supporting purely structural textual data format. We are following the FHIR standards while preparing and transferring health record over the ABDM system, as per the coding and guidelines suggested by National Resource Center for EHR standards.
So patient may ask, the data over ABDM system is secured or not?
See, basically ABDM system follows the data management policy as per the health data guidelines, where no one can access data without the consents from the patient. So in ABHA app, there is a consent management. We need to ask consent, and after the grant of consent, as a practitioner, I can only see their data.
So when something new come our market, people have some myths. They're thinking over that. So basically my question is, what do you want to say over myths on Ayushman Bharat health account? Some healthcare professionals start thinking and assuming that this project can track their financial activities.
See, when there is a new thing to implement, always there are myths. This is not one only with ABDM. This ABDM system is absolutely peer-to-peer, where no centralized system is keeping the health records. I can give you an example of polio vaccination scheme in the country. When it was initiated in the country, see, there were a large number of myths over the polio vaccination. But see the results at the end. WHO has given a certification of polio-free country in the 2014. So, if my software is running at Lifeline Hospital, all the data and health record of Lifeline Hospital is purely stored at my software server. So there is nothing like centralized system, means no one is keeping all the data. So your patient data is only at your software vendor server. Even a patient want to access that data, so there is a data management policy where a patient want to give their consent before receiving their data. So saying that all data is going to the government database server is nothing like that.
Mr. Khan, I really want to ask some administrative question. Sir, we get to know that one of the healthcare company wants to buy your company and they quote 1.2 crores. Can you tell me something about that deal?
Yes, this is absolutely true that there's a company with the name V Healthcare for Gurgaon, and they are asking to buy our company because of this ABDM compliant software. I respect for their proposal, but I denied it because I really believe that I am from the peoples who are always buy to something, not to sell.
At the last, sir, I just really want to say that in our country there is a vast youth who really want to start their own business and want to new startup. So can you please give any message to our viewers?
I'm not too much older that I can give a message to youth or I can quote something, but really I wanted to give a lesson to the viewers who wanted to start their own startup, that don't go with the copy paste. Start something very new, try something new, find some innovative, plan it, organize it, lead it and control it, and success is yours.